She was 71 years old, retired kindergarten teacher, did her morning walk every single day, 45 minutes, rain or shine, for the past 12 years. She took her blood pressure medication without fail. She ate the salads. She did everything the pamphlets tell you to do. And one Tuesday afternoon, while she was folding laundry, she felt tired. Not chest pain tired, not dramatic tired, just tired. Her jaw ached a little. She figured she'd skipped lunch. She lay down for a nap. She didn't wake up. Her daughter found her 2 hours later. And when the medical examiner confirmed what had happened, the daughter asked me a question I've carried ever since. She said, "Doctor, were there signs? Were there signs she missed?" The answer was yes. There were 5 of them. And none of them looked the way anyone expected a heart attack to look. I'm going to tell you what those signs were today. Because if that woman had known, if anyone had taken the time to explain this to her, she would very likely still be alive. Stay with me. My name is Dr. Marcus Reed. I'm a cardiothoracic surgeon with 31 years in the operating room. I have opened over 2,000 chests in my career. I have held beating hearts in my hands. I have stood at a table at 3 in the morning stitching muscle back together, while a family sat in the waiting room, not yet knowing their world was about to change. And in those 31 years, I have watched the same devastating pattern repeat itself over and over again. Not because heart attacks are mysterious, not because medicine doesn't know the signs, but because nobody takes the time to teach them, especially not the quiet ones, especially not to the people over 60 who need this information the most. Your cardiologist has 12 minutes with you at your annual visit. Your primary care doctor has 8. There is no time in that appointment to sit with you and walk through what a heart attack actually looks and feels like after 60. So you leave with your prescription and your lab results, and you carry on without knowing something that could save your life. That changes today. Here's what nobody tells you. Here's what you need to understand first about the body after 60. The heart does not suddenly become weaker overnight. It changes gradually. And one of the most important changes is how that muscle communicates when it is under stress. In a younger body, when the heart muscle begins to lose blood flow, when an artery is being blocked, the response is loud. Crushing chest pain, pain radiating down the left arm, shortness of breath so severe you cannot ignore it. That is the Hollywood heart attack. That is what everyone pictures. But here is the medical reality. After 60, and especially after 70, the body's nerve pathways change. Decades of living, inflammation, and in some people mild diabetic nerve changes alter the way pain signals travel. The heart muscle can be in serious distress, and the warning it sends is muffled, quieter, disguised as something ordinary. Think of it this way. Imagine a car with an old, worn alarm system. When someone breaks in, instead of a loud siren, it emits a faint clicking sound. Easy to miss, easy to explain away. The emergency is just as real, but the signal no longer matches what you were taught to listen for. That is what is happening in the bodies of millions of older adults right now. More than 40% of heart attacks in people over 65 present without classic chest pain. 40%. That is not a footnote. That is nearly half. And research published in the American Heart Journal shows that women over 60 are significantly more likely than men to experience these atypical presentations, which means they are also significantly more likely to wait, to dismiss, and to delay calling for help. In fact, studies show that women who are having heart attacks wait on average 37 minutes longer than men before seeking emergency care. 37 minutes. In a cardiac emergency, that is not a small number. That is the difference between a full recovery and permanent muscle damage. That is the difference between walking out of the hospital and not walking out at all. And here is the part that makes this even more urgent. The 5 signs I am about to walk you through are not rare. They are not the unusual presentation. For people over 60, they are increasingly the normal presentation. What medicine calls atypical is, in this age group, actually quite typical. The word atypical is a holdover from a time when the research population was predominantly younger men. The data has shifted. The language has not caught up. And that gap between what the research now tells us and what the average older adult has been taught is where lives are being lost. What you are about to hear are not exotic symptoms. They are ordinary sensations that ordinary people experience and explain away every single day. Knowing which ones demand your attention and when is the difference between calling 911 and going to take a nap. Let's go through all 5. The first one surprises nearly every person I've ever shared it with. We're talking about jaw pain, neck tension, or a dull ache in the upper back that appears with no obvious physical cause. Most people think jaw pain means a dental problem. Neck tension means stress or a bad pillow. Upper back ache means they slept wrong. And most of the time, they are correct. But here's the mechanism you need to understand. The pain signals from the heart muscle travel through a nerve network that overlaps with the nerves in your jaw, throat, neck, and upper back. When the heart is oxygen deprived, it sends distress signals up this shared pathway. And the brain, particularly an aging brain that has stopped expecting the heart to be the source of trouble, interprets those signals as coming from wherever the nerve pathway ends: the jaw, the neck, the left shoulder blade. In older patients, this is especially common because the referred pain tends to replace chest pain rather than accompany it. You won't feel it in your chest. You'll feel it in your face, in your teeth, in a band of tension across your shoulders. I have had patients spend 3 hours in a dentist chair convinced they had a cracked molar, and the real diagnosis was a blocked coronary artery. The specific fix here is not a treatment, it is a rule. Write that down. If you experience jaw ache, neck heaviness, or unexplained upper back pressure, and it is accompanied by any other unusual feeling, fatigue, mild nausea, slight breathlessness, you treat it as cardiac until proven otherwise. You do not wait to see if it goes away. You call for help. You tell the person next to you. If you are alone, you call 911 and you stay on the phone with them. That one decision, made in the right moment, is the decision that saves your life. The chest pain that everyone knows to fear will get you moving. This quieter signal requires you to have made the decision in advance, before the moment arrives, that you will take it seriously. Make that decision now. Now, this next one surprises people every time. And it is so ordinary that even I have seen seasoned physicians dismiss it in patients over 70. We're talking about extreme fatigue that appears suddenly and without obvious cause. Not the normal tiredness that follows a long day. Not the fatigue you feel when you haven't slept well. We're talking about a sudden, heavy, whole-body exhaustion that descends without warning. You were fine an hour ago. You didn't exert yourself, and now you feel as though your limbs weigh twice what they should. Here is what's happening in the body. When the heart muscle is under ischemic stress, when blood flow to part of it is reduced, it begins working inefficiently. The heart has to pump harder to maintain the same output. The body, sensing the strain, redirects blood from non-essential functions toward core organs. The result is a sudden, systemic energy crash. Your muscles are being rationed. Your brain is being given just enough, and your body is signaling, in the only language it has left, I am exhausted. For people over 60, this kind of fatigue is critically dangerous precisely because it is so easy to normalize. You've had a big week. The grandchildren visited. You're not sleeping perfectly. The mind generates explanations effortlessly, and those explanations can cost you dearly. The distinction to memorize is this: gradual fatigue, building over days, is usually not cardiac. Fatigue that drops on you suddenly, within an hour, with no clear explanation, at a time when you have not been unusually active, demands a different level of attention. Does any of this sound familiar? I want you to sit with that question for a moment. 2 items down, 3 more to go. And I want to tell you right now that item 4 is the one that even I had a significant blind spot about for the first 15 years of my practice. I've spoken with cardiologists who missed it too. You need to hear it. Stay with me. Here's where it gets complicated. The third silent sign is one that sends hundreds of thousands of people to their gastroenterologist every year when they should be calling their cardiologist. We're talking about nausea, indigestion, and upper abdominal discomfort that appears suddenly in someone who has no history of stomach problems. The vagus nerve, the longest nerve in the autonomic nervous system, runs from the brainstem all the way down through the chest and into the abdomen. It is intimately connected to both the heart and the digestive system. When the heart muscle is under stress, the vagus nerve becomes activated, and that activation produces nausea, sometimes vomiting, often a sensation of indigestion, bloating, or pressure in the upper abdomen that feels exactly like heartburn or gas. After 60, this presentation is more common than most people realize. The heart and stomach, through this shared nerve, essentially tell the same story in overlapping language. And because nausea and indigestion are so universally common, so expected in an older body, the response is almost always the same. A glass of water, an antacid, a lie down. The distinguishing factor is context and combination. Sudden nausea that appears alongside any other item on today's list, unusual fatigue, jaw discomfort, unexplained breathlessness, is a combination that requires medical evaluation immediately. Not in the morning, not after you see how you feel. Now, the question to ask your doctor, and write this down, is this exact question: could my nausea or stomach discomfort be connected to my heart? Most doctors will not raise that connection unless you do. Raise it. I need you to hear this clearly, because this is where the most preventable damage happens. The fourth silent sign is one that sounds so simple, it seems impossible that anyone could miss it. Shortness of breath that appears without exertion. You are sitting still. You are resting. and you find yourself breathing harder than the moment seems to require. In a healthy heart, blood circulates efficiently through the lungs, oxygen is loaded, and the cycle continues. When the left side of the heart begins to fail, or when an acute cardiac event is occurring, fluid backs up into the lungs. The lungs stiffen. Gas exchange becomes less efficient, and the body responds by increasing its respiratory rate. You breathe faster, more shallowly, trying to compensate for the oxygen the lungs can no longer deliver as easily. Here's what makes this so dangerous in older adults specifically. We expect some degree of breathlessness with age. Climbing stairs gets harder. Walking uphill takes more effort. These gradual changes are real, and they normalize breathlessness as a category of experience. So, when breathlessness appears at rest, when you're sitting in your kitchen reading the paper and find yourself needing to take deeper breaths for no apparent reason, the brain reaches for the familiar explanation. I'm out of shape. I'm tired. It's the humidity. The clinical rule is this: breathlessness with exertion is often benign. Breathlessness at rest, appearing suddenly, that was not present an hour earlier, is never something to wait out. Never. Not after 60. Call someone. Have someone with you. If it persists for more than 10 minutes without an obvious explanation, get evaluated. Starting tonight, I want you to pay attention to your resting breath. Not every moment, but notice. Notice if something changes. The fifth silent sign is the one most likely to be found in a wellness journal under the label stress symptoms. It is the reason so many people die without ever suspecting their heart was involved. We are talking about a feeling of impending doom, unexplained anxiety, or a sudden sense that something is deeply wrong, with no identifiable external cause. This sounds like a psychological symptom. It is not. It is a physiological one. When the heart muscle is in acute distress, the body's autonomic nervous system enters a state of alarm. Adrenaline is released. The sympathetic nervous system fires. Cortisol surges, and the conscious mind experiences this as a wave of fear or dread, a feeling that something terrible is about to happen, even though nothing in the environment explains it. This is a documented cardiac phenomenon. It appears in the medical literature as a prodromal symptom of myocardial infarction. Patients describe it in remarkably consistent language. I just felt like something was wrong. I had this feeling of dread. I knew something was happening, but I couldn't explain it. And in case after case, the people who acted on that feeling, who told someone, who called for help immediately, survived. The people who talked themselves out of it did not always get that opportunity. Have you ever felt that? A feeling of dread that arrived without explanation? A quiet but persistent sense that something in your body was off? That is not hypochondria. That is not anxiety in the clinical sense. That is your nervous system doing precisely what it was built to do, alerting you to a physical emergency using the only communication channel it has left when the usual pain signals are being muffled. Do not dismiss it. Do not rationalize it away. Let me ask you something directly. Has your body ever sent you a signal like that? A feeling that didn't make rational sense but felt undeniably real? I'm asking because I want you to take that signal seriously the next time it arrives. Your nervous system is not dramatic. It is not irrational. It is one of the most sophisticated early warning instruments ever developed. When it tells you something is wrong, in the absence of any obvious explanation, you listen. I want to be honest with you for a moment, not as a content creator, as a surgeon. I have stood at an operating table at 3 in the morning watching a team work on a heart that should never have been in that condition. I have seen muscle that had been dying for hours, silently, steadily, while the person went about their afternoon, dismissing sensations they didn't recognize as emergencies. I have walked into waiting rooms at dawn and watched families absorb information they were not prepared to receive. Families who had said goodnight. Families who had no idea they were saying goodbye. Families who would spend years asking themselves whether they had missed something, whether they could have acted sooner, whether the outcome might have been different if someone, anyone, had explained what to watch for. In case after case, the contributing factors were not mysterious. They were jaw tension that was attributed to stress. They were fatigue that was blamed on a long week. They were nausea that was treated with antacids. They were breathlessness at rest that was explained away as anxiety. They were a feeling of dread that was talked down as overthinking. These were not exotic risk factors. They were the background noise of millions of ordinary afternoons. And that background noise accumulated hour after hour while help was available and the outcome was still very much reversible. That silence cost people their lives. I have watched it happen more times than I want to count. And it is a big part of why I am here, talking to you now. I want to tell you about a patient. I'll call her Dorothy, 74 years old, former librarian, sharp as anyone I've ever met. She came to me after a cardiac event that had, by some extraordinary fortune, not resulted in permanent damage. When we reviewed her timeline, she described what the 18 hours before her event had looked like. She had noticed her jaw was sore and assumed she'd been clenching in her sleep. She had felt an unusual fatigue mid-afternoon and taken a rest. She had experienced a wave of nausea before dinner and skipped the meal. And around 9 that evening, she told her husband she felt wrong, that something was off, though she couldn't say what. He suggested she sleep it off. She woke at midnight, barely able to breathe. Her husband called 911 immediately. The team got to her in time. When I sat with Dorothy 3 weeks after her surgery, she asked me a question that has stayed with me. She said, "Dr. Reed, why didn't anyone ever tell me this is what it would feel like?" She wasn't angry. She was genuinely asking. She had been going to the same doctor for 20 years. She had read the pamphlets. She knew the word heart attack. She just had no idea what it was going to sound like from the inside. That question stays with me. It is the reason this conversation exists, and it is the reason you are watching right now. It is never too late to learn what your body is truly trying to tell you. And today, you have. Let's bring it all together. 5 silent signs of a heart attack that are commonly dismissed, especially in adults over 60. First, jaw pain, neck tension, or upper backache with no physical cause, particularly when it appears alongside any other unusual symptom. Second, sudden unexplained fatigue that drops on you without warning, not building gradually but arriving within an hour when you have not been unusually active. Third, sudden nausea, indigestion, or upper abdominal discomfort in someone without a history of stomach problems, especially appearing without a dietary explanation. Fourth, shortness of breath at rest, not triggered by exertion, appearing suddenly when you were fine just an hour before. This one demands action, not observation. And fifth, a wave of unexplained anxiety, dread, or the feeling that something is deeply wrong, with no rational cause to explain it. Your autonomic nervous system does not panic without reason. Now I want to ask you something personal, and I want you to answer honestly in the comments below. Which of these 5 signs have you or someone you love experienced and explained away as something else? I want to know. Not to alarm you, not to create fear, but because when you write it down and name it, you remember it. And remembering it in the right moment is the decision that changes everything. Tell me in the comments. I read every single one. If you are watching this and there is someone in your life, a spouse, a sibling, a friend, an aging parent, who is over 60 and does not have this information, I am asking you to send this to them today. Not someday, today. That one share could be the most important thing you do this week. I mean that without exaggeration. And if you want to keep receiving honest, evidence-based information that I genuinely wish every one of my patients had received before they needed surgery, hit subscribe. Every week, that is exactly what I bring you. One final thing, and this matters. Everything shared in this video is grounded in published research and reflects my clinical experience as a cardiothoracic surgeon. But your body is individual. Your history is your own. Before drawing any clinical conclusions about symptoms you are experiencing, and especially before making any changes to your medications or treatment plan, please speak directly with your own physician. That conversation is not a formality. It is the essential step. Better information, better conversations, better outcomes. That is the chain that matters. Your heart has been working for you every single minute of every single day for 60 or 70 or 80 years without ever asking for anything in return. Give it this.